The outbreak of the COVID-19 strain of the coronaviruses in 2019 took the world by storm. Caught unaware, the world literally shut down as nations devised means to fight the infection. Initially, the message was to prevent and control the spread of the disease. This worked for a while as scientists went to the lab, working their brains overtime for something better, a lasting solution, the COVID-19 vaccine. 9 months later, 3 vaccines have since been approved for use with more than 90% efficacy. They include the Pfizer, Moderna, and another from AstraZeneca. However, in a world of diversity, the vaccines have been received with mixed reactions. Some say it's a hoax, others think it's a good idea, but health workers like Dr. Samuel Oyugi and Joyce Ocheng, both frontline health workers, urge you to take the vaccine once you get it.
I got the Pfizer vaccine, which is actually 2 shots, and it is 2 shots 21 days apart. And so I got my first shot on the 21st of December, and 21 days later, I think it's January 11th, I go for my second.
Dr. Samuel Oyugi is a specialist in internal medicine at the Westchester Medical Center, whereas Joyce Ocheng is a critical care nurse in Pennsylvania, all in the US. They are among the first health workers to receive the COVID-19 vaccine shot.
I actually got the vaccine in the middle of my shift, and it was not soreness that would actually even stop me from anything. I did not even have to take like a Panadol or anything.
In fact, I had it in the morning and continued to work the whole day.
No fainting, because an internet story made rounds on social media where a nurse was seen fainting minutes after taking the vaccine. But this is what could explain her situation.
The ingredients that are put in vaccines are what cause a few side effects, including mainly allergies. And if you get the injection and you get what you call vasovagal reaction, where your heart rate goes down for some reason, you can faint. It is completely benign. You faint and you wake up.
It has taken the world's top scientists about 9 months to develop the COVID-19 vaccine, and many people have since questioned the speed at which it was developed. Dr. Oyugi says the science was already available.
The messenger RNA that is used to produce this vaccine is something that has been studied over a long time. And now because when this virus came, that was their opportunity to use this messenger RNA to try and develop the vaccine. So it is not something that was rushed out, and it's not something that this from start to finish took 9 months.
In the past, vaccines were actually made from the virus itself. So you take the virus, you grow it, and you inactivate it. So when it is dead, you inject it in the body after you add whatever you want to add to make it usable in the body. Then the body will recognize the virus and make antibodies to protect you from the real virus.
Health experts are warning that COVID-19 vaccine is just a drop in the ocean in the fight against the pandemic. This is because the requirement to have it distributed to more than 75% of the global population for it to be considered well spread out will not be achieved in the shortest time possible.
The developed world, just like what they did in HIV, need to step up and probably sponsor the developing nations so that we can, through a well-coordinated effort with WHO or some specific organizations, so that we can help the third world country that would have otherwise not been able to buy the vaccine.
The Ugandan government has already placed its order for 2 million vaccines from AstraZeneca. The first batch is expected in Uganda by June 2021. However, there are serious concerns on handling, storage and management of the vaccines once it's in the country.
Even us in the labs who work in specialized labs, keeping a -70 freezer is not easy. They're not easy to keep. They're expensive to run. They break down very easily. Temperatures will fall. So it's not easy. But you can imagine health centers in upcountry health centers in many of our countries, how this will work. Efforts have been made to use solar power and the rest to run fridges. How do you run -80.
The permanent secretary in the Ministry of Health, Dr. Diana Atwine, in a tweet chat with the public, said they will prioritize health workers and vulnerable groups as they scale up the distribution of the vaccine. Walter Mwesigye, NTV.